Call this meeting to order. We will start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the regular trustee meeting, January 26, 2021. Minutes of the regular finance meeting, January 19, 2021. And check report, January 9th, 2021 through February 8th, 2021.
I move we approve the consent agenda, items A, B, and C.
Second.
We have a motion by Dr. Brown, a second by Jay Randalls to approve the consent agenda as it was presented. Roll call vote, please.
Jasper,
Yes.
Hannaford,
Yes.
Randalls,
Yes.
Brown,
Yes.
Bob. Yes.
All right. Next item is the CEO's report. Candace?
All right, I really don't have a lot this month. We're excited to have Logan Merriweather. He's from Winoka. He's a PR marketing student from Northwestern who's doing an internship with us. So he's been working. You probably noticed some new Facebook posts. We were excited to have that. The door and camera project got kicked off a couple of weeks ago. They've been working hard to get our new cameras installed and the new door system in place. They ran into a snag with equipment this week, so they'll be back next week to finish that project up. No-Before, the online security training for employees to help train employees regarding phishing emails. That's going well. They had well over 300 attempts at training, and we had 49 clicks on emails and 5 attachments opened that should not have happened. But 289 of those were identified correctly, so I think we're getting somewhere on that. You can see a few things that Mark's working on. We had 45 inpatients last month, 212 emergency room visits, and we are going to surgery where those employees had been working on BAM infusions for COVID. Obviously that has slacked off a lot. We are going to get the surgeries going again, and their schedule is obviously packed full since they've had a little break. I did talk to Dr. Ransom today, and he gave me his official retirement notice. He'll be finished the end of June. And I've been working with Integris on a replacement surgeon, so we don't have anything definite in place yet at this point, but we are working on that. I'm also working with them on bringing an OB-GYN. They would be here every other week doing outreach clinic. A cardiologist from Dr. Schmidt's office, where he's going to be here on site the first to look at clinic space. And then we have moved Dr. Hummel, the eye clinic. We've moved him down to the West End clinic during COVID, just obviously a better choice, and that's been going well. We'll keep them down there for that clinic. And Dr. Whitson, of course, is still coming for the pulmonary clinic. So that kind of covers our outreach stuff. We are planning on opening the Winoka Clinic at the medical clinic down in Winoka. Dr. Hall's old clinic. We'll be taking that on April 1st. So we're making plans to put providers in that clinic, and probably looking at having that clinic open 3 or 4 days a week with providers from here. Upfront collections was just over $30,000, and the Tree Bridge project, we've been working diligently to try to take care of some of the issues, billing issues that we encountered after that first run, and then I think we've spent some time this week targeting some things that need more attention in those processes, kind of closing the gaps of things just kind of sitting out there not being dealt with, and trying to assign those and get those knocked out. So we're going to work really hard over the next few weeks of cleaning some of that stuff up that's been sitting out there for a while, just kind of hanging out, not being addressed. So looking forward to getting that True Bridge project smoothed out, I guess. Is there any questions for me?
Any questions for Candace? If not, Candace, thank you for your report.
Before we go any further, I do want to introduce Kiki Bowden. She is Rosemary's new helper. She's worn several hats, multiple hats for a long time, and we were about to wear her thin. So we hired Kiki, and she's caught on quickly and has been a lot of help for Rosemary. So we want to welcome her. She'll be here taking notes and running the board meetings for Rosemary. Rosemary gets to step out eventually, so welcome.
Yeah. All right, I'll entertain a motion.
Make a motion to approve, accept the share medical written report for February 23rd, 2021.
Second.
Have a motion by Dr. Hannaford, a second by Jay Randalls, to accept the Share Medical Center written report for February 23rd, 2021. Roll call vote, please.
Hannaford.
Yes.
Randall.
Yes.
Brown.
Yes.
Bob.
Yes.
Jasper.
Yes. All right, next is the CFO's report.
Mr. Chairman, I'm going to do most of the talking tonight.
Okay.
Chris came down with a head cold over the weekend, and he's been trying to lose his voice ever since. So we're going to let him sit back, and he's going to correct me when I mess up. And also, when you have questions, he'll certainly chime in and help answer those questions. So I would direct you to the tab that says Cfo Board Report. And behind it, you'll find the hospital financial statements for the month ending December 31st of last year. I can tell you with a great degree of certainty that we're going to have January and February's board reports ready for the next meeting in March. We have to because we have to do an 8-month interim cost report. That's due the middle of March, so we're going to definitely have those 2 months, and we'll be caught up at that time, and hopefully we'll be able to stay up from then on. We've kind of had the perfect storm of the last 6 months or so. We've spent a lot of time on cost reports for last year. We're still spending time on the audit of fiscal year 2020 audit, still ongoing. I don't think it's going to be presented at the next meeting, but I'm guessing the April meeting will have that financial audit complete, and it'll be presented by BKD just in time to start on
Start
the
a
next
new
one.
one.
And somewhere in there, we're still not sure if we're going to have to do the federal single audit. That's basically a compliance audit because we received over a certain amount of funds from the federal program. Not real sure if we're going to have to go there yet or not. So that may be in our not too distant future also. But Chris and I are working diligently to get caught up and get a lot of this behind us. We still got a lot of reporting to do to Department of Health and Human Services for how we've spent stimulus funds. Unfortunately, they haven't told us yet, after almost a year, how we can spend them or how we're going to report that to them. So everything's in limbo when it comes to stimulus funds. But anyway, that's kind of where we're at and where we're going to be. So looking at page 1, the report itself, starting off on a negative basis here. First thing I say is operating cash was a negative $63,000. I want to assure you that even though on the books we had a $63,000 negative amount for cash on December 31st, we were never overdrawn at the bank. It was strictly a timing deal. We've had so much money flow in and out of this place in the last few months that sometimes the timing may be a day or so off, and it just happened to catch us right at the end of the month, which was on a weekend. So that's really not a problem. The money was replenished, that and more within a matter of a day or two after the end of the year. So we're in good shape cash-wise. Actually, we kind of have the problem with more cash than we know what to do with because of stimulus funding, but that's going to sort itself out at some point. Accounts receivable balance, $5,480,000. Unfortunately, that continues to increase of almost $200,000 during the month of December. Chris may want to address that, or if you have questions about why that's happening, I hate to keep kicking TrueBridge when they're not here to defend themselves, but I think that's been a lot of our problem with accounts receivable and getting that under control. Accounts receivable, as you all know, it's kind of a two-edged sword. You like for it to go down, but when it goes down, you question whether maybe your business is going down. Or are you doing a better job of collecting? Well, we're trying to do a better job of collecting and get that accounts receivable balance down consistently over a period of time. Because we sure need the cash flow. Gross days in accounts receivable have gone up because of that increase in accounts receivable. Accounts payable balance at the end of December was about $340,000. That's about 23 days of operations. Gross patient revenue actually went up in December, and that was probably somewhat driven by COVID, I would imagine, because we definitely had a higher patient count than we've had in quite some time because of COVID in December and January. Thankfully, that has gone way down. In fact, I'm not sure that we have a patient right now. Inpatient. $67,000 increase in patient revenue per month over the prior month. Patient days are up, as we talked about. Clinic visits down a little bit. I think there's been a reluctance for people to see their doctor, physician through this pandemic. Very understandable, and that's something that's being seen nationwide, probably worldwide. Contractuals, 41.3% of gross patient revenue, so right off the bat, we can't collect that 41.3%. That's written off by the insurance company. Charity care for the month of December, about $12,000. Operating expenses actually went down during the month. Hospital salaries and wages for December, $636,500. Increase of $230,000. And if I were you, I'd probably be saying, Steve, what's going on? How could you possibly hire that many more people or pay that much more in wages? What we did in December, starting in December, we started paying what we're calling COVID pay. It's additional pay because of the pandemic we're in, because of the effect it's had on nursing, and really all different segments of healthcare have been affected by that. Some people have retired early. Some people have gone elsewhere where they can get more money. Some people probably just don't want to be out here maybe as much as we want them to. So we're giving them an incentive, rewarding them for their hard work. But that's why you're seeing that huge increase in salaries and wages. The good side is that money is reimbursable through our stimulus money, so we're not really out anything. We have to pay the wages, but then we get to reimburse ourselves. Now, sometimes there's a timing difference, just like we talked about. Might be a little timing difference between when we make the payment and when we get reimbursed from our stimulus funds, but we try to stay right on top of that, keep the cash flowing through the hospital. Operating profit for the month was actually $468,000. A lot of that was because of COVID revenue. Stimulus funds that we converted to income during the month. Net profit after sales tax, $510,000. On the next page, you'll see that December of 20 column that we've just been talking about. The numbers look really odd, especially starting on the other operating revenue. You'll notice $820,000 of other operating revenue. Most of that is stimulus money that we are reimbursing ourselves with to pay for COVID-related expenses that the hospital has had. So you can see that's had a huge impact on the income statement. Even with the inflated salary amount, we're still showing a sizable profit for the month. The problem with that is that's going to vary from month to month while we're in this pandemic. As you can see for prior months, it just kind of depends on where we're at, what's going on, and how people are using the hospital. But don't think there's anything else out of the ordinary there. Do you have any questions about any of that?
Is the year-to-date comparison, is that through December or is that through January?
December as well.
Okay.
On the next page are other expenses, which just break down that other expense line to give you more detail about what they consist of. The largest one is purchase services, which we purchase a lot of agency nursing and emergency room doctors. High cost involved in those. That's why that number consistently is as big as it is from month to month. The following page is a two-year comparison to where you can compare the month of December of 20 with the month of December of 19. Here again, inpatient was up considerably, but that would be in line with the fact that our census was up considerably. December of 19, if you're thinking, wow, that month looks really bad, that was a bad month. That was the month a little over a year ago that we had some problems with our computer system. We went down for a period of time. We actually weren't able to book any revenue for a period of time. So December of 19 is a really lousy looking month. I'm hoping that's one we can get way behind us in the not too distant future. And then your year-to-date figures, which would be for the first 6 months of each of those 2 fiscal years. Anything there you have a question about, or anything we can clarify? Next page is statement of cash flow. I'm not going to really spend any time on that. It's a difficult statement to understand and explain, and I don't think you're going to be any wiser by the time I get done if I try to do that. So, next statement is the accounts receivable analysis. You can see a somewhat disturbing trend there that we talked about. Actually, the difference between November and December, probably a lot of that is just an increase in business for that month, since December did really well. But we're struggling with collections, but we're working diligently on it. The next page page just breaks down by who the payer is and what percent of the total of accounts receivable they represent. Final two pages are the balance sheet. Again, some really big numbers on there that we didn't see in the prior year, like a restricted cash. On the second page, some liability amounts that are much larger than they were in the prior year. That's all driven by the pandemic and how we're dealing with COVID and the stimulus funding we're receiving and how it's being spent. So this year has, for many reasons, been a very unusual year. It continues that way, but I think the end is in sight. I'm just not sure exactly when that ends going to be. Any questions about any of that? I'll go ahead and refer you back to the convalescent home tab. Kelly's going to go over his actual report, but I'll just run over the financial statements with you. Cash balance, we had $132,000 at the end of December. That's 11 and a half days of operating expenses without depreciation. Accounts receivable balance went up some in December. We had about 77.8 days of business in accounts receivable. Accounts receivable balance was up slightly, and this represents about 5.1 days of operating expenses. Kelly and Tanya and everyone at the nursing home have done a really good job of keeping their bills paid, holding down the cost of operating. Even through the pandemic, they've been really good about holding their costs down. Kelly's probably had to use more agency nursing than he would like, but that's just part of the pandemic and how this thing's playing out. It's taking, we can't grind our employed nurses, down to dust by overusing them. We got to use that agency nursing, and it's been, Kelly can speak to that, but I think it's been really good and mostly good experiences. Operating expenses were up about $10,000 over the prior month. Salaries and wages, similar to the hospital, a big figure for December, almost $300,000, which is about $104,000 more than what we paid the month before, but that is COVID wages mostly, and we're able to reimburse ourselves out of stimulus funding for that. Here I kind of messed up. The nursing home did show a operating loss and also a net loss. That last line should say net loss. And we can see on the next page 6 months of activity, December in there. Page after that, breakdown of miscellaneous expenses from that miscellaneous expense line. And then page 4 is a 2-year comparison between the years. And the final 2 pages are the balance sheet for the nursing home. Any questions about anything financially from the nursing home? If not, the next section, the next tab is the Homestead financial statements there. 6 months of income statements with the far right column being the current, or the month we're looking at, December 20. Bottom line down there, $12,000 of net income. It looks like, the revenue's staying up and everything's working well at the Homestead. Any questions about anything at the Homestead? Did Chris or I answer any questions on any of those financial statements or anything financially related that we might have? If not, if not, I'm going to shift to, I handed out a couple of handouts that I do every month, and this is showing how we're spending the stimulus funding. The thickest one says hospital up at the upper left-hand corner. That first section is the money that we've received, total from HHS and other agencies that have provided us with provider relief funds. From then on down is how we've expended those funds, operating expenses we've had by the week, capital expenditures on page 2. You can see we've spent about $750,000 in improving the facility in an effort to keep COVID out, or if it comes into the facility, dealing with it once it's in here to keep it from becoming even more of a problem. So I feel really good about everything we've done from a capital asset standpoint. We've been able to buy some really good equipment that's going to help us a lot going forward, helping us deal with COVID right now. We've been able to make some improvements to the facility also with that in mind. And we continue to do so. As Candace mentioned, we got some ongoing projects. There's a couple of projects still going on at the nursing home that we're involved in. I took this a little further in that down at the bottom of the page 2, I went ahead and looked at everything that's happened after January 31st. Now, I forgot to mention that this is everything we've looked at so far has been for January of this year. Now we're going to go ahead and look at the rest of February, what we've done so far, and an estimate of what we're going to be doing the rest of the month. But you can see down there, operating expenses are running about, this is COVID-related expenses, are running about $24,000 a week. Payroll expenses, we pay every 2 weeks, so we've had a payroll this month, we're going to have one more. That's the COVID wages that I've been talking about, that we're going to get reimbursed by stimulus funds, or we already have been. And then we've got some other capital expenditures down there, and mainly wrapping up some projects that we've already started, have yet to pay some balances on. So you can see we have a lot more going on. At the end of the day, as of actually at the end of February, we're in that $475,000 figure as far as what we have yet available to use from stimulus funding. Any questions about any of that? I know it's a lot to look at and comprehend. I guess the main message I would like to impart to everybody is everybody out here is working really hard. Fortunately, we've had some funds to work with that have helped, and we're getting through this thing.
I might point out that the COVID pay does, we will no longer do that after March 1st, since we're kind of getting to a point where it's leveling off and probably not going to ever go away completely. We've let them know that after March 1st we won't be paying that, unless we have another wave that hits, we would consider it maybe.
The other handouts on the nursing home, similar format. HHS, I think, has realized that nursing homes have had a tremendous impact from COVID. They continue to get funds to nursing homes on a fairly regular basis. Nursing home got 2 checks in November, another check in December, one here in January, and I think we've already gotten a check in February. So continue to get money. They realize nursing homes have a lot of expenses because of the pandemic, and we've kind of shown you how we've been using that money and some of the capital projects down there at the bottom of the first page. Also kind of pushed this out to the end of February. You can see that at the end of February we pretty well exhausted funds, but like I said, we continue to get funding. Don't know how much longer that's going to last. It's kind of been amazing through this that you don't hear a thing from HHS, and then all of a sudden you get your bank statements, there's $500,000 in the bank statement. Just shows up. No explanation of what it is. Usually they'll give you a little idea of what it's for, like the nursing home. We can tell which one's a nursing home, but no correspondence from HHS. You can see we've gotten close to $4 million. They don't seem real concerned about that at this point, but I'm sure there'll be a day of reckoning somewhere down the line. But that's kind of how the stimulus funding is working out here. Do you have any questions about any of that? If not, before I lose my voice, I'm going to quit talking.
Any questions? If not, Steve, thank you. Next item is Medical Staff Executive Committee. Matt, looks like we have some credentialing. Is there anything to report from their meeting?
Nothing we haven't talked about, except, I can't remember, like, we talked about cardiac calcium scores. Radiology department, with the new CT machine, we'll be able to do cardiac calcium scoring. It's kind of an indicator of whether you need to go see your cardiologist. If you've got a high cardiac calcium score, it's indicative of heart disease, and we'll be doing those. We'll be running a special in March. Those will be $55, and that's to cover the read on that. And then we'll do those after that, I think, for a cash price of $75 following this.
Will there be something put out
Yes.
media-wise on that?
Mhm.
Okay.
Yeah, they're just not quite ready to do that yet, billing-wise, but that should be coming out soon in March. Anyway, that's all I got on that.
Okay. So the credentialing committee met?
You want me to do that?
Yes, that'd be wonderful.
Absolutely.
All right.
All right, so courtesy staff, we have reappointments. Can I do all of them, the reappointments?
Yeah, vote on that individually.
Vote individually, okay. So we have reappointments to courtesy staff, Gregory Blair, MD.
Make a motion to reappoint courtesy staff Gregory Blair, MD.
Second.
We have a motion by Dr. Brown, a second by Dr. Hannaford to reappoint to courtesy staff Gregory Blair, MD. Roll call vote, please.
Randalls,
Yes.
Brown,
Yes.
Bob,
Yes.
Gaspard,
Yes.
Hannaford.
Yes.
Next is reappoint to courtesy staff Zahid Chima, MD.
I make a motion.
Cool.
I make a motion that we reappoint to courtesy staff Saeed Chima, MD.
Second.
We have a motion by Dr. Brown, a second by Jay Randalls to reappoint to courtesy staff Zahid Chima, MD. Roll call vote, please.
Brown,
Yes.
Bob,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Randalls.
Yes.
Next, we have a reappointment to courtesy staff for Gregory McKinnis, MD.
Make a motion to reappoint to courtesy staff Gregory McKinnis, MD.
Second.
Have a motion by Kim Ball, a second by Dr. Hannaford to reappoint to courtesy staff Gregory McKinnis, MD. Roll call vote, please.
Bob,
Yes.
Gaspard,
Yes.
Hannaford,
Yes.
Randalls,
Yes.
Brown.
Yes.
Next is a reappointment to courtesy staff for Dr. Robert Rader, MD.
Make a motion
Hang
to,
on, he's a DO, isn't he? What?
I'm looking.
What? Hang on, Kelly's looking.
I can go with it.
Kelly's looking it up.
Can we go to the next one?
Yeah, we'll do that while he's looking it up.
Okay, reappointment to courtesy staff.
Says
Simon.
MD on the website.
MD,
All right,
my bad.
okay, so we're going to stick with Dr. Rader.
Go back to Dr. Rader.
make a motion to reappoint courtesy staff Robert Rader, MD. Second.
We got it.
MD.
It's good.
It's right.
Trust yourself.
Jay, did you second that?
I did. All trust me.
Have a motion by Dr. Hannaford, a second by Jay Randalls to reappoint to courtesy staff Robert Rader, MD. Roll call vote, please.
Casper,
Yes.
Hanford,
Yes.
Randalls,
Yes.
Brown,
Yes.
Goff,
Yes.
Reappointment to courtesy staff Salman Zubair, MD.
Make a motion to reappoint to courtesy staff Salman Zubair, MD.
Second.
Have a motion by Dr. Brown, a second by Jay Randalls to reappoint to courtesy staff Salman Zubair, MD. Roll call vote, please.
Hanford,
Yes.
Randalls,
Yes.
Brown,
Yes.
Goff,
Yes.
Casper,
Yes.
And finally, a reappointment
No.
to...
There should be two.
Who?
Julie?
Julie Mahaney,
Where did she go?
she's not on yours?
she's on the agenda.
Okay, well, is Benjamin Love next?
He's
No,
last.
after Julie.
I missed her in the minutes for the med staff, but she's on the agenda.
Oh, gotcha. I'm going up a minute. How about Julie Mahaney, MD, reappoint to courtesy staff?
Make a motion to reappoint to courtesy staff Julie Mahaney, MD.
Second.
Have a motion by Dr. Hannaford, a second by Jay Randalls to reappoint to courtesy staff Julie Mahaney, MD. Roll call vote, please.
Randalls,
Yes.
Brown,
Yes.
Goff,
Yes.
Casper,
Yes.
Hanford,
Yes.
And finally, reappointment to courtesy staff Benjamin Love, MD.
Make a motion to reappoint to courtesy staff Benjamin Love, MD.
Second.
Have a motion by Dr. Hannaford, a second by Jay Randalls to reappoint, for the reappointment to courtesy staff Benjamin Love, MD. Roll call vote, please.
Brown,
Yes.
Goff,
Yes.
Casper,
Yes.
Hanford,
Yes.
Randalls,
Yes.
Okay.
Awesome.
Is there anything for Quappy?
Just a couple things for Quappy that we worked on in committee. The tagging process, when you have a piece of equipment that needs to be repaired, there's specifically a tag out system that needs to be put in place, and we have worked on that process to improve that. Also, the system that we approved for the air cleaning ion units, that has been installed on the first floor and in all patient rooms to clean the air, which not only helps with COVID, but for many other things. So we're excited to have that in place. And that is really all
For Quappy?
for Quappy.
Okay. Next item is improvement to patient care. There is a contract validation calendar.
All of those contracts have been reviewed and compliant, with the exception of the passport. Health communications needs to be archived.
Okay. Any questions on that? If not, Candace, thank you. Next item is the Sheriff Convalescent Home Report. Kelly?
This being the January report, January was kind of where we got really overrun with COVID. If you look about halfway down the first page there, it kind of gives you a timeline of how we went through our COVID progression from our first resident testing positive on November 24th all the way to having had 22 by the end of January. and now we're at 23. The last one we got, though, we don't get to count that one as our own. It was a new admission, and within 2 days of admission, they tested positive. So the state allows us to consider that exposure from another facility and doesn't require us to be in an outbreak. It was a rough month, though. We ended up having 6 discharges, including 5 deaths that, I would say were either directly or indirectly related to COVID. And so it's been it's been really hard on our staff. They get to, we don't experience it that much. We do experience end of life, as part of our business, but to have that much that fast, it's not something our staff are used to. And we've really had to work on, just some, basic build each other up kind of things instead of, the guilt or the finger pointing or the things like that sometimes happen when these things occur. And so one of the things we are doing now that we weren't doing before is we have put together a memorial wall. It's across from the chapel inside the building there, and it's a place where the staff are able to go through and write some memories down about the different residents, and then after it's been out there for a little bit, we'll share those with the family. A lot of them will probably have directly shared their thoughts with the families or whatnot, but this is maybe for some of those that maybe didn't know the family as well, but knew the resident very well and that kind of thing. And residents are able to use that as well, write their, memories and whatnot on that, and we'll share it with the families. And I'm really pleased with how that turned out. It looks real nice in the building there. That being said, our census decreased quite a bit in the month of January. We went from a 43 in December down to 37, a little over 37 in January. We had we had 20 hospital days, so residents who were in the hospital had about 20 hospital days as compared to December we had 9. And probably the biggest change in our January versus our December is the number of SNF days or skilled nursing days. Medicare allowed that when a person tests positive for COVID, that we can go ahead and put them on Medicare A services without what's generally required is a 3-night stay in the hospital. So, we were able to do that. We'll see probably a change in cash flow because of that. We might have already seen it. But where we bill for long-term care at the beginning of the month, Medicare pays after we bill Medicare. So we'll see kind of a change in cash flow, but with that we'll also see a pretty significant increase in revenue because we're in the difference between skilled nursing and long-term care is obviously that we're providing a higher level of care. It's the same level of care as you would get in swing bed at a hospital. So that's it's going to help out our revenue quite a bit. We did, from an activity standpoint, kind of neat. We've purchased about 20 walkie-talkies, and we're playing walkie-talkie bingo. We're going to have a walkie-talkie resident council meeting before long, and we're trying to overcome this mandatory social distancing and all that stuff. But fortunately, though, that was even short-lived a little bit, but we're ready if it comes back again because last Thursday we came out of our outbreak, and so we've been able to get the residents back to the dining room for meals, limited capacity. Same thing with group activities. Visitors are back in the building again, and it's we have been, we kind of had limited visitation prior to our outbreak happening, but once our outbreak happened, it was like basically none. If somebody was near the end of their life, we were getting family members in as best we could for that. But really, there was nobody in our building after our outbreak hit, so the floodgates have opened, and we are scheduling visitors left and right, and it's good to see them. It's good for our staff to see our family members coming in just as much as it is, maybe not just as much, but it feels like it sometimes for the family members to be able to see them as well. So it's been great to have civilians back in the building, if you will. We've had all of our vaccine clinics at this point. The resident numbers are here in the report. We have had, with the exception of one resident, they have all either had the vaccine or tested positive for COVID in the last 90 days. And the ones that weren't eligible for the vaccine do plan to take the vaccine when they become eligible. And maybe by that time there'll be a one-dose vaccine they can take. So we're hopeful for that. I think I told you about our BAM infusions last month, because I know I did, because I was excited about that. You can see in here our resident satisfaction surveys. I highlighted, we kind of keep an eye on these 6 areas with how are they satisfied with staff, our housekeeping, transportation, dining services, activities, and overall. We're not quite where we want to be in all those areas, but I will point out that with our dining services, it was a surprise, and I'm very proud of our crew, but we were better than the benchmark for the companies that participate in this same survey across the nation. So glad of that. Our nurse call response times in January improved despite everything that was going on. So that was good. We improved by 20 seconds on the average, with an average time of 3 minutes 54 seconds. As far as the facility is concerned, we have the engineers were supposed to be here last week. Weather curtailed that, but they'll be here Thursday and Friday this week to look at beginning the planning for our HVAC system upgrades. The code alert and door security system, they are on site this week. They were here today working on door locks and everything, so we're getting those installed. We continue to work on our phase 2, which is our final phase for our point-click care implementation. We did, and I'm pretty proud of this, less than 2 years ago, and really less than 1 year ago, we were a 1-star facility, as you know, in the Medicare 5-star rating classifications. And in January, when we got our ratings, we were up to a 3-star facility. So I think I told the board a while back that we had achieved a 4-star status with our staffing, and that was going to be important in order to get the other stars up, and we're moving that needle. So I'm really pleased with our staff. We've had a significant improvement in turnover, and so we're really getting to the point where the staff that we have are gelling together, and it shows. And so real pleased with how the team is doing. You can see kind of the reflection of how the team feels about each other with the employee satisfaction numbers there. These bolded areas are the ones, this is on the second page near the top, but the bolded areas are the areas where we're outperforming the benchmark with the survey company, and 93% satisfaction with teamwork, 93% feel appreciated, 97% organization advocate. Those are the people that are calling their friends and saying, hey, you got to come work here with me, you know. And so we're real pleased with those numbers, and we're still trying to move the needle on some of those other numbers. I'll point out 85% of our staff feel safe. That's probably had the biggest amount of improvement, as we've really had a difficult time with the staff feeling comfortable around this whole pandemic. When we first started seeing, 60%, or only 60% feel safe at work. We were really worried about that. And that's improving quite a bit right now. And as people are getting where they can understand the pandemic a little bit better. And we have a lot of first-time healthcare workers working for us. And so they naturally were a little bit unsure about what was going on. So that's improving. You can kind of see some of the things we did for morale there written in the report. Steve mentioned our agency numbers. As you get down about middle of the page in that table, our January agency dollars were the lowest they've been since I've been here, and about half as much as they were the month before. Our dollars per patient day for direct care is up quite a bit, but when I went back and looked to see why that was, well, it's because of the incentive pay for COVID and that kind of thing. So we will be finishing up the COVID pay with this pay period, or the previous pay period that ended on February 20th, and for all staff, but for staff that are in our COVID wing, we dedicate staff to that wing so they're not back and forth through the building. And so for the staff that are dedicated to that wing, we will continue to pay COVID pay as long as they're taking care of COVID patients. If there's not any COVID down there, we're not going to pay them COVID pay, but that will have a significant impact on our payroll. We also talked about Medicare A. I haven't mentioned this yet, I don't think, in the board meeting, but our DON, Tierna Adair, and Rita Goodrich and I have been participating with OU Health Sciences Center in kind of a quality improvement program initiative, and it's a 16-week program. We're a little over halfway through it at this point, and it has been nursing homes across the state were selected to participate in this. It's part of a grant that if we participate in the majority of the program, we're going to get a $6,000. I'm just dreading that we finish this program and they're going to say that your training was worth $6,000, and that was the grant. But I'm counting on them sending me some cash. But it's been really good, especially for Tierna and I as newbies to the nursing home leadership kind of capacities to be able to hear from other providers across the state and hear some best practices and do some of those things. And we're able to use not all of it, but some of that those practices as we implement our process improvement items. So that's the nursing home. Happy to answer any questions.
Any questions for Kelly? If not, anything additional for the Homestead or the foundation?
Homestead, Steve mentioned the revenue. It's Homestead's money in the bank, seems like. So they're doing well. Their census has stayed up around 40, which is about 71% occupied. They have opened back up for visitation as well. They have a full staff as of January, so they got their open position as a resident services coordinator filled. Shauna Cook filled that position. She's doing a great job so far. Carla continues to hone her skills and do better in that position as the director, and I'm very pleased with how things are going over there.
Okay, very good. Anything for foundation?
No, sir.
Okay. Next item then, city council report.
With the weather, city council was canceled, so no report.
Okay. I don't have anything else to report. There were no items of new business, so we are adjourned.